You're watching Let's Chat.
You may have heard a lot about the exciting new things that are going on over at Erlanger Medical Center, especially as it pertains to their orthopedics department. Joining us here is Dr. Mark Freeman, and Dr. Freeman is the head of the Erlanger Orthopedic Institute. Dr. Freeman, good morning.
Good morning.
Hey, and in the interest of full disclosure, this is the same Dr. Freeman that put a new hip in me a couple of years ago. Dr. Freeman, outstanding job.
Well, thank you. I'm glad you're doing well.
I am doing well. Hey, you got some new exciting things going on at Erlanger Orthopedics as it pertains to robotics. Tell me about this.
Sure. So technology has always been a part of orthopedic surgery, whether for fracture care or joint replacement or other surgeries. And so technology leads the way. And so Erlanger has helped us lead the way with increasing technology availability for surgeons in this region. And that includes computer-assisted devices. It includes handheld devices. It includes specialized templating software and computer software before and during surgery. And now recently it also includes robotic systems, both robotic systems that are robotic-assisted orthopedic surgery and also computer-navigated devices for use during surgery.
Is that kind of thing sort of rare for this area?
There are hospitals around who have access to maybe one of these systems. Erlanger is one of the few in the country, and certainly the only one in the region, that has access to multiple of these platforms. And the reason that's important is it increases the availability and access to patients. It also increases choice for patients and the surgeons. Most of these systems require the surgeon to use one particular company's implant, and so by having multiple systems available, our surgeons at Erlanger have access to multiple different companies' products, including different types of joint replacements, both by the same company and then multiple different companies.
What is the benefit? What is the benefit to the patient and to you, the surgeon, when it comes to using one of these robotics to put in, say, another hip or another knee? Tell me about that.
So similar to other industries, it increases, and these are theoretical benefits currently. There's much research going on around the country to try to prove this. But robotic systems and computer-navigated systems, we think, help increase precision, increase accuracy, and hopefully over time increase the efficiency of doing a good job for patients. Now, at the same time, this is not robots taking over surgery to where I, the surgeon, am either not in the room or not at the field.
Right.
There are certain arenas in surgery and other disciplines where that's the case, but this is assisted. So I'm still at the field. And the reason I think that's important is, robots can make things more accurate or precise. And I was thinking about this on the way in this morning. Robots could paint a picture that's more precise, but there still is an art in medicine, and there still is experience and a factor of the surgeon's experience and engaging with that patient during surgery to figure out what's best for them. And so this is sort of the best of both worlds. You have the precision and new instrumentation to help with accuracy, precision, and making good execution of the steps during surgery, but you still have the surgeon at the field engaging back and forth with the computer and also involved in the patient care. And so I think it's the best of both worlds.
Now, I know many of the surgeons on your team are fellowship trained. What's the advantage of that to the patient?
Sure. So training is important for everything, right? We train pilots appropriately. Training in medicine is also important. And most orthopedic surgeons go through 4 years of medical school, 5 years of an orthopedic surgery residency. Then they could go out into practice and become board certified. However, most surgeons who do hip and knee replacement and shoulder replacement full time do an extra year or more of specialized training in joint replacement. And so again, most of the surgeons in the Erlanger Orthopedic Institute are fellowship trained with an extra year or more of additional expertise, specialized training in joint replacement surgery.
All right. Dr. Freeman, always good to see you and to talk with you, and thank you so much again for your contributions to me personally and to our great community. Thank you so much.
Absolutely. Appreciate the time.
Yes, sir. Anytime. You can find out more about Dr. Freeman and his orthopedic team at Erlanger. Go to erlanger.org/ortho. That is erlanger.org/ortho. Stay with us. We will be right back.